Hi everybody. How's it going? Happy Saturday to you. Dr. Vuong here, world's famous weight loss surgeon, author of 13 books. I got an amazing guest today, Dr. Michelle Gordon, who's a New York surgeon taking care of the sickest COVID-19 patients that you'll ever hear about. So I'm going to bring her on here in a second. So do me a favor. This is a super important broadcast. Hit share for me. Hashtag replay if you're going to watch this on the replay. Prayers and blessings to everybody in the upstate New York tri-state area, Connecticut, New Jersey. I know you guys are going through a really hard time right now, and we want to give you guys all the positive, good, healing energies. Dr. Gordon is practicing up there in Westchester County, 1 hour north of New York City, and she's going to come back and tell us about an update about what's really, really happening here. And we're going to talk all things COVID and what you can expect, the level of care that your sick ones are getting. And yeah, so let's hit share for me real quick. And while we're waiting on that, I want to give you a coronavirus update. Today is Saturday, April 17th, I think. I forgot. And we have over 2 million cases worldwide, 138,000 deaths worldwide. In the United States, we have over 600,000 cases, 641,000 cases, and over 28,700 deaths as of today. Obviously, everybody knows the hardest hit state is New York, with over 213,000 cases and 11,500 deaths. But we've done a really good job of blunting the curve. We've really brought down the numbers. We are going to be way below the 100,000 death toll for the United States. But even then, at a death toll of 40, 50, 60,000, that's more than necessary. Could have been a lot worse. With a death rate of 3 to 4% and number of deaths of 50,000, you're still looking at 2 million cases in the United States alone. And so we are at 640,000 cases. So we're well on our way to 2 million. This is not over yet. We're also, President Trump also yesterday announced plans to reopen the country. We're going to talk with Dr. Gordon about if that's a good idea or not. So get your readies, questions like this ready for our special guest today, Dr. Gordon. Sandra Claus, that's cute, right? So make sure you have a nice picture there. Good morning, Lisa Jane Riley. How are you guys doing? So I can get to bring you guys on like that. So that's a really amazing opportunity, right? Oh yeah, it is Friday, isn't it? Wait, where did it go? There you go. I forgot it's Friday. My days are pretty off. Friday, April 17th. Excellent. All right. Okay, guys. With that, let me bring on Dr. Gordon. Wow, we have over 500 people watching. So let's bring on Dr. Gordon for you guys. Go ahead and hit share for me one more time. That'd be absolutely, absolutely amazing. Dr. Gordon is head of the Gordon Medical Group in New York. She is a board-certified general surgeon, but she specializes in hormones and menopause, actually, and she has been called on duty to the front lines of this COVID-19 pandemic. We did an amazing broadcast a couple weeks ago that got a ton of views, but we had Zoom problems. So this time I wanted to bring her back, and I'm using a different platform, and I'm able to broadcast onto Facebook Live as well as YouTube to give her the attention that she deserves for being on the front lines. She's dedicated the last month of her life of putting herself at risk, as well as her child and family at risk, taking care of these very, very sick patients. And it's my honor and privilege to bring back the amazing Dr. Michelle Gordon. Yay! Give it up for Dr. Gordon, everybody.
Thanks so much. Thanks so much for having me. First of all, I just want to say it's Gordon Surgical Group. We're not a medical group. It's a surgical group only. That's okay. And yeah, and so it's not surprising that you called it Saturday because it's quarantine days.
That's right. You're getting lots of love and thank yous, and I just want to hear. And yeah, man, we got 700 years, so let's go into this.
That's great.
Yeah, last time you were here, you're in Westchester County, right?
I am.
Right,
Yeah.
an hour north of New York City, at a little community hospital, relatively. But you guys normally run 5 to 6 ventilators at a time.
5 to 6, 5 to 7. I mean, we have a 10-bed ICU, 10-bed PCU. We usually don't have any vents in the PCU.
Yeah, and give us an update. You were already so vents last time. What's it like now?
Yeah, so we had 34 events when I talked to you a couple of weeks ago. The highest number of events, I'm pretty sure, was around 50 something. And then we got some help from the community hospitals in the area, and we got some help from the Comfort. And we actually shipped out patients, and we're down to 20, 21 vents now, which is still a lot. What we ended up doing was we had our PACU, which did not have individualized rooms. We had turned our PACU into, that's post-anesthesia care unit. So the post-op people were being treated as it was as another ICU. And then what they did was they took the amp surge area, which had more individualized rooms, and put up like makeshift doors and things like that. And that became another ICU, and we actually had a doctor down there that was doing it. Taking care of that area.
You said something kind of controversial last time, which was that everyone on the vent ended up dying. Do you have? Is it the same, or have you?
It is not. We've been able to successfully extubate a couple of people, and that was just my experience. And I understand that was controversial. I said a couple things that were controversial. I said that. I mean, I say a lot of things that are controversial. That's just me. But I said, you die alone. Everyone dies alone. It is hard, I think, for the families of people who are really, really sick because they're not able to be there. And because we don't want them to get sick, as well, and it's just not a good place to be. But in terms of like what we saw, we were seeing most people on the vent were dying, and still, when you look at the numbers, and I like to look at Worldometer. And of the closed cases of coronavirus in the whole world, that's about 715,000 people. 21% of those are resulting in deaths. And it's still 4% is serious or critical. So in terms of our mortality rate, I think our mortality rate in the US is somewhere around 2.6%. I haven't done the numbers in a while. Haven't looked at them.
About 3%. New York is like 4%.
Yeah, New York has gone up, but the UK was, the last time I did the math, was about 12%. I mean, it was really bad there.
Yeah, and Italy's even higher than that.
Yeah. So I mean, we have to respect this virus. We have to respect the fact that it will kill us, and the fact that we've followed the shelter in place, and we follow. You and I both thought that we'd have 1 million cases in the U.S. by last week by Easter, and we're seeing that that's not quite happening. I mean, we're behind now because we're doubling now about every 8 days instead of every 4. So staying home has helped. Washing our hands has helped. But it still kind of sucks. And I know that there were some riots in Lansing.
Well, let's talk about that real quick. And not to get too political, but President Trump yesterday announced a plan to open up the economy again. What are your thoughts on that?
Listen, I don't get involved with that. I mean, here's what I think. I mean, my understanding is that China tried to open things up and had a surge. My feeling is that probably a lot of people went to see people on Thanksgiving. I mean, on Easter, and with that, we may see. I think we should wait 2 weeks and see, because I think we're going to see another surge, and I kind of think that as we reopen, we're going to see more and more surges.
I want to get back to reopening, but you just opened that door, so I just thought I'd take that question. But I want to talk back about ARDS. There's been, since we last talked, I did that video about how we die, how coronavirus kills us. Yes. But since then, there's been a lot of hints that this ARDS is slightly different, including this microthrombotic event inside the arteries of the lungs. What do you know about that? Is that what you saw in the ICU? What's happening there?
Yeah. So what we were seeing is a lot of these people that required hemodialysis, and so they needed, artificial kidneys. A lot of them were having clotting problems, and we saw a lot of that. We would put in the dialysis catheter, and then the catheter would clot, and then we'd put them on heparin, and a lot of those people, once they get to dialysis, they don't survive, but we have to try. What we think the mechanism of action is the what's happening is we see a lot of inflammation, and then we see people who are predisposed to endothelial damage. So people with underlying heart disease, erectile dysfunction, diabetes, anything that causes microvascular disease is susceptible to endothelial dysfunction. And then with the cytokine storm, we get a bigger inflammatory response. And we've seen this over and over and over. And so there's a few trials that are going on about, I've read about either heparinizing or using Lovenox. You don't want to use Lovenox in kidney disease. So it's a really difficult problem. I mean, the disease is really fascinating because we don't know anything about it.
Two surgeons, we're gonna have to take the lead. One of us is gonna take the lead.
Yeah, no. I'm just saying, that's it.
Do you think the clotting problem is secondary to sepsis, or is it something innate about the coronavirus?
I don't know. I mean, the thought is that it's the endothelial damage, and the whole, we've seen that permissive, permissive low O2 in these patients with nasal cannula and negative pressure room and prone, right? So we don't intubate them. We just let them have low O2, and some of them will get better.
Oh, you froze on me. I lost Michelle. Oh, there you are.
I'm here. Yeah.
Dr. Gordon, you froze on me.
I don't know why.
They shut us down, Dr. Gordon. They shut us down.
Who shut us down?
Oh, no.
You can't hear me?
On my screen,
I'm okay.
Oh, there you are.
I'm here.
You're here.
I'm here. I'm hardwired. I'm telling you, I hardwired because I was having so many problems with Zoom. I hardwired myself.
Okay. I might need to do that. I got your back.
Yeah.
We have, believe it or not, we have over 1,200 people watching, which is amazing.
That's great. Hey, everyone.
Yeah, hey. And so do us a share. Give some love to Dr. Gordon for being on the front line. What were you talking about when I lost you?
So we were talking about the endothelial damage, and we're not sure. And we're talking about how fascinating this disease is for us because we don't know anything about it.
Yeah.
That's what's so really interesting about it is it's just a really, I mean, from a standpoint of, a medical standpoint, I mean, you must find it to be fascinating too when you read about it.
Well, honestly, I'm just kind of glad I retired.
I mean, we've been putting a ton of lines. These people have, they do have some really serious problems. But one of the things that we're noticing is that there was a randomized COVID-19 trial, and hydrochloroquine did not give any benefit.
So let's talk about that real quick. So hydroxychloroquine and a Z-Pak, do you think that's helpful? Like, where are we with that?
Well, I mean, nothing I have seen has changed what I know, and that as an outpatient, it may work. But by the time you make it to the hospital, you're probably not going to, it's not going to help.
Not going to help. Yeah. I put that too, that we didn't really have any good studies or conclusive evidence that hydroxychloroquine and Z-Pak was helping people in the ICU. And that I got a lot of negative comments about that, which I thought
it's not. I mean, the biggest studies are now with the new, I think Gilead's drug, Remdesivir, I think is how it's called. And that's actually giving some,
HIV drug, isn't it?
I don't know. I don't treat HIV. I just, I've been reading a lot about COVID and treatments. So
do you think that it's a good idea for people to go and start taking a hydroxychloroquine and
no
for it? No.
Well, let's not forget that there are side effects. Whenever we're doing any sort of treatment, as physicians, we have to do a risk to benefit ratio, right? Risk to benefit, and we have to weigh each one of them. So I don't know if you can see me, but I'm like trying to weigh say scales, right? And if the treatment is more harmful than just letting things run their course, then we don't like to do it, right? I mean, that's one of the problems with cancer treatments. They can cause a lot of problems, and in the same case, hydroxychloroquine and Zithromax can both cause heart problems or torsades, and that's an arrhythmia that can be fatal.
Mm-hmm. Well, let's jump right into it then. Is the treatment worse than the cure? Do you think shutting down the country and causing this economic crisis, do you think that was worth the cure, or the treatment was worse than the disease? What do you
I mean, I'm a surgeon. I'm not an economist. I mean, you're asking me all these politically charged questions.
I know it's a little, but we all have friends whose restaurants and businesses and stuff are being affected, and employees and lost jobs.
No, my business was affected really badly. I mean, we lost revenue, and we've, I mean, I think there's you can see both sides of it.
Yeah. Anybody who's unemployed or lost a job, we really feel for you, because we, medical assistants, all the hospital workers, we really feel for anybody. But do you think the treatment was worse than the disease, and what do you think?
Look, I mean, if you do the math, right? Let's say we get 80% penetrance of a disease that kills only 2% of the population. 80% penetrance of 300 million people. I mean, I can't do it on my head. So I mean, I'm smart, but I'm not that smart. So we've got 300 million.
Yeah, 200
right?
million. Yeah.
Right.
Yep.
So that's 4.8 million people dead.
Mm-hmm.
And by staying home, we've flattened the curve to the point that, maybe we'll get to 2 million cases in the US. Now, remember, we're not testing. We probably have already gotten to 2 million or 3 million cases. It's hard to say, because there's a lot of asymptomatic people out there. And again, we won't know until we truly understand how this virus works, its whole mechanism of action, what it does. We're not going to know the complete penetrance at all. But the fact that, some people get really sick, but they, and die or get better. Some people are like not symptomatic at all, but are carriers. And that's what makes this such a scary disease, and why I think it was right to tell people to stay at home.
There you go. So do you think that everybody should be tested?
If it's yeah, it's a big glass. So I drink like 5 of these a day. So
not vodka, everybody, not vodka. This is
not vodka. Yeah. Well, what time is it? It's only 1:15. So do I think everyone should be tested? I think that if we can get a cheap enough test, then, and if it's an antibody test, then we might want to consider it. And, when you think about the mechanism of action of coronaviruses, we have a short amount of immunity, and then we can get reinfected. That's the common cold, right? That's how the common cold works. So if we could turn the coronavirus into a common cold, or if we can get antibodies that work, I think that's going to be the treatment. Most of our vaccines all come from antibodies and antibody treatment.
Right? It's more deadly than a common cold. It's 10 to 100 times deadly. So
absolutely.
I want it to be a common cold. I think I want it to be more like chickenpox, where you get vaccinated and you're cured.
It's a different type of virus, though. It's a coronavirus. It's the chickenpox is not a coronavirus.
Correct. Yeah.
That's the problem, and I don't. So we don't know. I mean, we're seeing just today, we're seeing we can get a positive test that can follow negative testing. After somebody's been negative, they can be positive, and I think that the Koreans saw that, and I think we're starting to see some of that too.
Yeah, well, we know that the test itself is only 70% sensitive, so there's 30% missing.
We're waiting for the antibody test. I mean, I think we've just ordered some, and we're just waiting to start doing it as an outpatient. And I haven't tested myself, but I mean, I'm pretty sure that I had it. I was feeling pretty crappy, and I mean, I never had a fever, but I was like, short of breath, and I took an inhaler a few times, wasn't able to exercise.
One night about a month ago, I had about a 12-hour period of chills in the night, and I felt it like coming on at 6 p.m. And I have a crazy strong immune system, and I just felt weak, and I had chills. Erica tested me for fever. I didn't have a fever, but the next morning I felt it break during the night, and the next morning I felt fine. But I'm pretty sure that was probably coronavirus meets the Asian immigrant immunity system, and I won.
Oh, that's so funny.
Yeah, I'm curious to see too, because then Erica got sick. My girlfriend got sick, and she was sick for about a week. And she's recovered since then, and she said she felt really like crap.
Yeah, sure. My cousin was really, really sick when I was with her. So I think it just hits different people different ways. If you have if you lost your sense of taste or smell, then you probably have gotten it, plus minus.
1,400 people watching right now. Thank you so much.
Okay. Thanks for coming on, everyone. Robert asked me, have you seen the blood type as a factor in death rate? No, that's not something we track.
Who is this, Dr. Gordon?
What's that? Listen, I'm a podcaster. If you want to, we got the Menopause Movement podcast. And so I always look for questions.
I got a question for you, a little bit controversial. Yeah. What do you think about that video that sort of went viral from that doctor in New York who said this was like a high altitude sickness and that we're treating these patients wrong and it's not ARDS and stuff like that?
Well, I think we don't have the data. I think we don't have the data. I mean, like I said, when you give high flow nasal cannula O2 in a negative pressure room and you allow the people to have low O2, some of them get better and some of them don't. And remember, we're taught to work from an algorithm, right? I mean, we're surgeons, but even the critical care guys, we all work from, if this happens, then do that. If this happens, do that. And we've got a cookbook, and this virus is brand new, and we have no cookbook for it. And so we're going to treat ARDS just like we treat ARDS. We're going to see, we're treating it like we see it, and we're seeing some people are getting barotrauma, so an injury to the lungs from the ventilator and needing chest tubes and things like that. But that happens with ARDS too. And so it's an ARDS-like picture, but it's also pneumonia and it's also sepsis and it's also this whole cytokine problem. And so there's a lot of physiology that's involved there.
What about giving, did you guys give IV vitamin C for these critically ill patients? And did you see if it made a difference?
We ordered it, but I don't know that we really give it. We haven't. I mean, and some of these anecdotal cases show, IV vitamin C plus an antiviral have really helped people. And we don't know whether it's the IV vitamin C or the antiviral. And so in our case, I mean, we're a small community hospital. We don't do as, many protocols. And the whole system in New York was really overwhelmed. But I have to say that it's really getting better. I mean, the governor has said that the number of admissions have gone down. We're still seeing, 600, 700, up to 800 deaths a day. But it's we are seeing fewer people in the hospital.
I feel like you've peaked then.
I hope so. We're going to see, Easter. I really do think, people probably got together for Easter. And so I think in 2 weeks we're going to see another peak. Yeah. Might be, you think bimodal or, peaking distribution, some sort of a curve that goes up and down, up and down. So, yeah, I'm not sure. Yeah. But I mean, the infectious disease doctors that I've talked to have said vitamin C, vitamin D, zinc are all, things that you want to take. But just remember, if you're going to take vitamin D, don't take more than 5,000 units.
Yeah. Well, what's the deal with zinc? Why is that helpful?
Yeah, I don't know the mechanism. I'm sorry. I don't know. I don't know. I know that zinc helps. I mean, if you think about, coldies, taking a little bit of zinc when you have a cold. So my guess, and this is just purely a guess, it keeps the virus from entering into the
last time I looked at cell. It said that zinc somehow helps the function of a hydroxychloroquine. But I know it's a thing, and I know you need some zinc for healing and for like healing skin incisions and stuff like that if you have poorly healing wounds.
Right.
So there's something with that too. That's excellent.
Yeah, we prescribe zinc at 220 milligrams for 2 weeks max for people. But remember, in wound healing, it's a factor of nutrition and vitamins as well. And so sometimes you have to increase the protein intake, and you make sure they have vitamin C, because you need the vitamin C for the collagen cross-linking. But in this instance, I think the zinc is more protective. I mean, I'm taking over-the-counter zinc like twice a day.
Yeah.
Because I have to go to the hospital. So it's almost like voodoo, right?
So other than social distancing and staying at home, which we know works, if you had a friend or someone call you and say, "What can I do to stay healthy?" what would you tell them?
Wash your hands. Wear a mask when you go in public, and if you're going to wear gloves outside, right? Remember that any surface that you touch then is contaminated. And so you're not going to wear gloves. If you, let's say you're going to the grocery store, right? When I go, or I'm just going to talk about it like when I go into the hospital. I go into the hospital, I open the doors with my hands because that's the only way. I get in to where my mask is and I wash my hands, put my mask on, go out. There's no gloves in that room. So I go out and I open the door, and then I wash my hands again when I have to, anytime I have to touch something. And then when I have to go into a patient room, or for the rest of the time where there are gloves on the floor, I'm wearing two pairs of gloves. I have my N95. I have a hat on my head, and I'm wearing a gown. And that's to interact with COVID patients. And what I would do in a grocery store is I would have gloves in the car that I put on as I leave my car. And then I would go in to the grocery store, put my stuff in the thing, and then as I was checking out, putting my stuff, before I put my stuff in the car, I would then probably remove the gloves. But there's no guarantee. I mean, you still got to clean everything, and then you got to take your clothes off when you get home, and then you got to put them in a bag and go. I mean, it's just it's exhausting. It's exhausting. The hypervigilance is exhausting. Does anyone agree with that?
Yeah. It's a lot. It's a lot of hand washing. And so what about supplements? What supplements would you tell your friend or family member?
Yeah, vitamin C, I would say, 1,000 milligrams a couple times a day. Over-the-counter zinc a couple times a day, and vitamin D, because we're not outside as much, and almost everybody needs vitamin D. Lack of vitamin D can be a factor in a lot of diseases.
And we know the importance of calcium regulation in terms of, channel signaling for our muscles and stuff like that.
Of course. Yeah. And magnesium, magnesium is a supplement, I think, that is often overlooked. And especially if you're having a lot of, this has nothing to do with COVID, but just in terms of regular health, if you're having a lot of muscle cramps, then magnesium and to a lesser degree potassium, but mostly magnesium. We don't like to supplement with potassium too much because that can cause heart
problems,
electrical abnormalities. So be careful with potassium. Just eat a banana here and there.
Last time we talked, you said it's real. The whole trailers, the refrigerated trucks out back. What's the status on those? Are they getting filled up? Are they being moved?
Well,
do you know?
Yeah, I don't. I'm not involved with the morgue, so I don't see that. I know that Elmhurst Hospital, was still had a lot of people, that were passing away, and the morgue was full. We were having a lot of deaths at our hospital, and our morgue is pretty small, so it's, they have to do something with those bodies. So they
Do you know if the coronavirus is still alive on the bodies, on the corpses, or what's the status on that?
I don't. When you look at the studies that, especially like from the cruise ships where, it was staying alive on surfaces for up to 17 days. I think that the default is that it's probably still alive, and it's alive in the body fluids, and it's alive in any expelled gas. We've seen that it's alive in feces. It is, so it's a pretty freaking robust virus.
Let's talk about that, because there was a warning put out about feces and fecal transplants. So the thought originally was that you drink water and it rushes and it pushes this virus down to your stomach acids, and the stomach acids would kill it. But somehow it's making its way through the GI tract. Am I thinking off, or is that?
No, it is. It's just a robust virus. It's figured out a way to survive in our system, or to infect us.
Acids and stuff in the stomach.
Yeah.
How else is it getting? How is it getting from the respiratory tract into our fecal?
Well, unless it's coming, unless it's on the skin, unless it's on the skin and it's coming, but I actually don't know. It could be, really, there is that.
Or you'd have to walk around it or something.
Yeah, it could be, fecal oral. We know it's a respiratory virus, but think about it this way: if you have. Yeah, that's what like a 4-year-old will do, right? So it's not something that adults will normally do. So I'm thinking that if you have, I'm thinking that if you have translocation, and if you are infected and things, who knows? It could help force some sort of a leaky gut. It could, you can get translocation into the gut. I don't know. I really don't. And the mechanism of action is going to be fascinating when we find it out.
By translocation, you mean that it's in our bloodstream when we're really sick, and it's made its way through the GI tract, through the cells into our stools.
Yeah, and it may not require cytokine storm for that, but it does cause inflammation. I think I think that the people who have an underlying, inflammation are a little bit more at risk, and so that goes back to the proper diet, which is, I know, something that you teach, and getting rid of like boxed food. It's not food.
I know it's not your area of specialty, and it's kind of morbid, but do you think like we're going to have mass burials? Like, is the opportunity for people to have a single funeral to bury their grandmother, is that out the window? Are we going to have mass?
Well, no, I think they're actually cremating the bodies. We talked about this the last time, and I think that these COVID bodies are being cremated, and they're doing like Zoom meetings or FaceTime or something for their funerals.
Oh.
But I haven't called the funeral home to find out. It's just,
So let me ask you another question. This is kind of sad too. So if we think the virus is staying alive for 17 days on these corpses, that means like organ donations are going to go away for a while.
Yeah, I don't think that, I haven't seen anything about organ donation. These patients are all infected with something that we don't know how to treat. And so we can't use these people. And we are testing, we're testing patients that come in through the ER. They're all getting tested for COVID now. And, I think I said the last time, we did an operation, the lady was negative. And so we were happy about that. But we just, a couple of days ago, just had to operate on a guy who was really sick, and also had COVID. So.
Wow. So when do you think that we'll get back to being able to do elective surgeries? Because in Trump's rollout plan, he does talk about phase 2, phase 3, where you can start doing elective surgeries again. Do you feel comfortable with that, or what's your criteria with that?
I think that in order to kind of get people back from their furloughs, think about what's happened. It would just talk about the economics of healthcare. We've got elective operations are the lifeblood of a hospital in terms of finances. And this as a bariatric surgeon, you brought in a ton of money for the hospital. And when you're able to do, 10 cases a day and just bounce from room to room, or 10 or 20 maybe, that's great, right? And that the more patients you can do, it's just like a factory. The more you can do, and I'm sorry to, we don't look at people as factories, but when you're looking at corporate medicine, it's like a factory. It's the same analogy. So I'm not cheapening people's lives. What I'm saying is that it's just like a factory in how we run it. So when the hospital is not getting that work. Oh, now you have frozen on me. There we go. Awesome. So when the hospitals, are we back?
Yeah, we're back. Go ahead.
Okay. So when the hospital's not getting that work, they don't have money. And so they furloughed a whole bunch of people. We've got all the OR staff who aren't working. And so it's a long way to say that, if we're going to get the economy rolling, one of the things we need to do is start doing elective surgery again.
We do. And there are hospitals that are closing down. And like you said, hospitals provide a lot of good, high-paying jobs for a community. And it's one of the major employers of a community is their local hospital. So some of these little local hospitals are closing down because they just can't afford to keep this shut down. Maybe they're in a small area that doesn't have a lot of COVID cases, and they're really getting wiped out. So it's problematic.
Yeah. And so, and then we have like a lot of doctors who are having to take a pay cut because, 20 to 30% pay cut just because there's no work. We have doctors who can't see patients in their office because, and some people have started to take patients, but they're checking people for a fever. And when you say, okay, so I'm going to have you in my office and I'm going to check you for fever, but you've got corona and you're not symptomatic yet. And now we've got 17 days of this corona living on the surfaces. And so it is a conundrum. It's a huge conundrum.
What do you think about the future of telemedicine? Because I see it as like people are getting used to Zooms, they're getting used to live. And so I think there's a huge opportunity there to streamline the doctor's office to do telemedicine. You could handle a lot to stay on track so patients don't have to sit in the waiting room. I think it's a huge
listen, I think what's happening is we're in a place where we have globally reset. A lot of industries do not need people to come to work. Even in my office, even in my surgical office, I have and I've had this for years. I've had somebody who works from Florida. She always did stuff from Florida. I have another guy who's up in up in the Northeast in New Hampshire, or Maine, but way up there. And, and at the end, and I had somebody in California for a long time. So, at the end of the day, when you have the ability to connect through a local hub and meet and make things happen, why are we making people to go in? Why? And so I had 3 conferences cancel in the last month, and all 3 of them were done virtually. What do I miss? I miss networking with people. I miss interacting with people. I'm kind of an introvert, and I kind of stick to my own thing in a lot of ways. And what I love about going to a conference is meeting new people and making it, usually I'll make one friend at each conference.
Yeah. Well, Dr. Gordon, I want to take some viewer questions here in a second. So everybody watching right now, if you found massive value of this, please hit share for us to get, we got 1,700 people watching. We can get that over 2,000. Just hit shares right now.
Yeah, great.
And we're going to get your questions ready. So go ahead and get your questions ready to put in. I'll put you up on the screen. But Dr. Gordon is really, her love, passion is really hormones and helping people to menopause movement. Talk about what you're doing real quickly while people are hitting share so we can give you
Well, so I have the Menopause Movement podcast, and that's on Apple or Stitcher or wherever you get your podcasts. It's all over the place. And so you can go to that. We've got we're approaching 50 episodes. And so we've got a couple really great things coming up. This week, or next week. This week we just released yesterday, or the day before, released Menopause Yoga with Petra Coveney. And then next week we have, start your online business now. Because I figured that, well, for anyone who is, stuck at home or is furloughed, we have the most unemployment claims in our country in the history of the country. We have the most people that are unemployed. And so if you want to start a business, if you were been thinking about starting a business, then, next week that we're going to be releasing that. And then I have another one was like how different Enneagram types are responding to the the thing. So that's one, so there's quite a few really great things coming up in the podcast. So make sure you subscribe to the podcast. And then the other thing is that I've got a free 2-week course that's coming up but it's only for women, guys. It's not for the men.
How much are you? How much is it?
It's free. It's free. All you have to do is fill out an application, and it's free in exchange for testimonials and feedback. And so it's on managing your menopause and understanding your hormones. So all you have to do is go to bit.ly/menobeta.
Okay, let me type this: bit.ly/menobeta.
Lowercase.
Oh. All right, excellent.
Don't break
it. let's take some questions here.
And if you just have to go through the application process, and then we'll get you in.
Melissa Kaiser wants to know how accurate is testing when it's been 2 weeks since symptoms.
Well, I think the antibody test will be 2 weeks since symptoms. The antibody test will be accurate. I don't know about the nasal test. I think, again, it's only 70% accurate. So, you got to have 2 negative tests before you can go back to work and stuff. And you got to be free of symptoms. So
we got a medical question.
Yeah.
5 latent clotting disorders, is it a high risk factor?
Yeah, it actually probably is because you're already clotting. But if you're on Coumadin, it may help. But again, we don't know the mechanism of action yet of the clotting disorder, and so we don't know what's causing that. So we can't really say whether it's Coumadin or not.
Mr. Simon, the hospital of reinfection.
Yeah, I think that it's a possibility because of the common cold, and the only way time is gonna tell. We should be seeing some information out of China by now. Again, we don't know if it's accurate data or not. I mean, they just upped the number of people that were sick in Hubei province.
What? So, China lying about their numbers? No.
You think? Oh no, not really.
My co-worker wants to know, I work for what is our future? Well, up there all up in the grill, doctor. Coronavirus.
Yeah.
Get ready, everybody.
You know what I think? I think that the dentists are really at risk. And anyone who's, I think it's going to be N95 or those respirators with the, that's going to be working with those. And that,
my girlfriend just got braces right before this happened. And so she's freaking out because she can't see her orthodontist.
Oh, she doesn't have Invisalign?
No.
Oh.
I talked to her about that. Angela wants to know, nebulizer being avoided, and I'm seeing MDIs used 8 puffs every 4 hours. Is that big? Woo, that's a lot.
Wow, that's a lot. It depends on what kind of MDI, but I'll tell you, that's really a question for a pulmonologist. If you're using albuterol 8 puffs every 4 hours, you really have to watch for like some arrhythmias and, ugh.
Oh, that's tough.
Yeah.
That seems like a high to me. Kirsten Shaw wants to know, do you have patients who experience metallic taste in their mouth?
Well, the patients I see are really, really sick and not awake, so I haven't asked that question.
Well, we know if the virus seems to affect your sense of taste and sense of smell, which is taste is connected to smell for sure.
Yeah.
Oh, Timothy wants to know, how many strains are we up to now?
I don't know.
I
don't have that answer.
There's like 2 main strains, right? L and S, I think, and then there's variants off of it.
It's just I know it was mutating every 2 weeks. So
here's a good question for a surgeon: how effective are surgical masks?
Yeah. Well, let me tell you, when I operate, it's the last operation I did was an N95 and then a mask and then another mask with a face shield.
Wow.
Yeah, so it was hot. And 2 hats.
What about people making these homemade masks and going out to stores? What do you think of those masks?
Well, I think if you're making a mask with a HEPA filter, you're probably okay. If you're making a mask with anything else, it's not going to really help that much.
I agree. Hey, if you guys are enjoying this Q&A, please hit share for me. That'd be awesome. Here's a good one from Canada. Cindy wants to know, what about our loved ones who are vaping and COVID? Vaping, do you think it's a risk factor?
Well, anything that's going to cause more inflammation in your body, I think, is a risk factor. And so, vaping, I mean, if you're going to smoke, you're going to, do things like that are going to cause more inflammation, then you're going to be more at risk.
Mm-hmm. What about marijuana smoking?
Same thing. Marijuana is it's toxic. It causes inflammation in our bodies. If you're smoking it now, there's benefits of CBD. As a matter of fact, I've got a whole podcast on that. But if you, and there's ways to take CBD that will help, put you to sleep, and yeah.
Not that
I don't. Marijuana makes me paranoid. I don't like it, but I've used CBD. I find that I get really sleepy when I use it, but it helps some people. Yeah, good question. That's a great question.
Here's a good question.
And I don't have the answer, but Diamox, we use it in altitude sickness, and I don't know if there's any studies. I hope that they come out.
We talked about that mountain sickness thing, and I don't know.
Yeah.
Oh, hold on. How about this? Meditative Year Stress Journal. I'm glad you're very healthy at this time. I agree with that.
Absolutely. Oh, me too. Yeah, meditate every day, a couple times a day. I journal every single morning. Absolutely. As a matter of fact, this is my journal. You probably could see it. Oh, yeah. I bought this in Santiago. Isn't it beautiful? Yeah.
Yeah.
So every morning it's sitting right there.
Vacuum filters work in masks. I don't know.
I don't know.
Unknown future forecast. Best discipline hygiene practices will stand above all else.
Yeah.
I think so.
I agree with that. Yeah.
From Desavere. Shows good
promise. I think that's the one that is showing the most promise right now. Is remdesivir.
Here's a good question here. Where can you asthma take allergy shots? Am I at high risk? Allergies is so confusing when people have bad allergies, because a lot of people don't realize I have allergies too, but you can get like fevers from. Did I freeze on you?
Oh yeah, that's okay.
How can you tell the difference between allergies and COVID?
Well, I think COVID is. I don't know that you really can. I mean, right now is allergy season, and so I don't. If you get more sick, then you may. I don't have the answer.
This is a good question about what happens after you survive a COVID infection. Is there any lung damage?
Well, there may be. I mean, there was a pulmonologist who got it. Mm-hmm. And he was
SARS.
Yeah, he was talking about coughing up necrotic lung.
Oh, he froze.
So
let me see.
And you're gonna have
You froze on me. Sorry.
I'm here. It's okay. We'll just wait it out.
Oh, here we go. So you said
okay, I'm back. Yeah. So the doctor with necrotic lung, and so my expectation would be that you might get some scarring, just like you would with, you think about like a baby, right, who has lung disease of a newborn, of a preemie, and they have lung problems their whole lives, a lot of them, and so you may have some lung damage later. You might have some vital capacity lost.
I have a patient who had H1N1 who's still on oxygen. He's a young guy too.
Yeah.
Oh, negative blood. What's the deal with blood? Blood type?
I don't know. I don't think there's anything with a blood type. I'm not one of those believers in blood type.
I agree.
Yeah.
What about, let's ask some controversial stuff here. What do you think about let me see. What about I'm trying to find that one so I can turn it off.
Just click it again.
I know. I got comments.
Oh,
like this.
Yeah, the comments are just coming. Yeah.
So what do you think about, is this last time we both agreed that this wasn't a biowarfare man-made lab thing, but now I'm not so sure, man. Some of the conspiracy theorists got my attention. What do you think now?
Well, all of the studies that I've read have shown that there's nothing about it that looks like it's anything that came from anything but an animal, that it jumped from an animal. Mm-hmm. I think it's, the whole bit, with the White House or the administration saying that they're looking into it being a bioweapon from China. I think that's them trying to control the narrative. I think it's just the tail wagging the dog. Every pandemic has not been man-made, and so I'd like to believe that it isn't. Hey,
look at that.
Wanda, yeah.
I don't know.
We like working together too.
I think at the very least, I would say China probably might have deliberately misled us.
Oh yeah, I think they had a problem probably back in November or maybe even October. Yeah. Yes, we do see sometimes it's that it'll present with a rash. I've not seen the rash, but I did read about some dermatologists who talked about having a rash is the presenting sign.
Yep.
Yeah.
How long has the COVID-19 been in the US, do you think?
Well, officially since January 10th.
Officially. Some people are saying I was really sick back in December and I was like knocked down for 2 weeks. Most likely, I think that was probably influenza B, but I'm not really
I mean, most likely it was flu, but we don't know. We just don't know. We'll never know, probably.
Lots of news releasing probable cause of death COVID-19 last Tuesday. I'm not really sure what they're referring to.
So what they did was they increased the number of deaths based on thinking that it was a probable cause of COVID-19. And so because we're not testing everyone. And so we're saying we think that, because of the way they died.
Oh, I see.
And this is a really good question, Christina.
Yeah, so we know that the coronavirus attaches to the ACE receptor.
ACE2 receptor, yeah.
What about ACE inhibitors? Do those help?
I don't think ACE inhibitors help, but they might make you a little more susceptible, but I don't know. ACE and ARBs, the thing is that if you are taking an ACE inhibitor or an ARB, that's an angiotensin receptor blocker. If you're taking those, you already have some inflammation and some endothelial dysfunction. But you're asking me to give you answers to questions that we haven't studied, and so I just can't answer.
Yeah,
but it's a good question.
China lab back in October. We've already answered that. Why is it long to ramp up testing for everybody? I think it's a huge task. I mean, what do you?
Yeah, we've got a country of 330 million people, and we didn't prepare. I mean, we knew it was coming, and we didn't prepare.
What's your stance on NSAIDs and COVID-19?
Well, I know that we don't like to use NSAIDs in asthma, and this is a problem that affects the lungs. And so I would just take that right across the board and say, stay away from NSAIDs.
This is a good one. What are the?
Yeah, we're seeing all ages. We have, some people on vents in their 40s. The people who are passing away are usually much older than that.
So death is still higher, but anyone can get it?
Yeah. Mm-hmm. Yeah. I mean, we don't treat pediatrics at our hospital, so I can't speak to pediatrics.
If you're working in a hospital, would you wear
Hi, Terry.
all the time?
Yes, I wear a mask. As soon as I walk in, I have a box where I keep a mask, and I'm wearing an N95 mask the whole time I'm in the hospital.
Mm-hmm. That's really good. Oh, how many symptomatic patients do you know that have recovered?
Well, my cousin, but she wasn't in the hospital. And then, we've had plenty of people in the community who have been tested positive and recovered. But, in terms of like somebody who was on the ventilator and got off, I know of one. Mm-hmm. But that's just my patients. So I don't take care of all the patients in the hospital. So, don't take my experience as, these are patients that I've like put lines in and seen and stuff.
You've come up. We're nearing an hour, and you've been very generous with your time. And I know you probably got to get back to work, but we'll end it with a controversial one.
You love the controversy.
I do. Bill Gates. What do you Did he do this on purpose? Did he create it? Is he profiting from selling the vaccine? And
well, listen. I don't watch the news, so I need you to tell me what you're talking about when it comes to Bill Gates.
I don't watch the news either, but they're saying how Bill Gates predicted this, did a TED Talk 5-6 years ago about a pandemic, and now here it is, and he's forcing people to have a vaccine, and he owns the company that's going to make the testing and the vaccinations and all sorts.
Well, I don't know what the truth is there. I mean, I know that Bill Gates has a foundation. My brother used to work for it, and their problem is malaria, and they're trying to fix malaria. Mm-hmm. Whether Bill Gates is profiting off of the pandemic, I mean, listen, there's a lot of companies are profiting off the pandemic. Zoom is one of them. StreamYard is another. So I mean, I don't have anything against anyone profiting ever. I just don't. And so if Bill Gates makes a profit, good for him. If he loses money, good for him. That isn't an issue to me. The bigger issue for me is we've known another pandemic is coming for a long time. This isn't, and we, Obama back in 2015 had a speech about it. And he said, we need to make sure that we're ready because we think this is going to happen in the next 5 or 7 years. And then when the Trump administration came in, they just kind of ignored that directive, that whole initiative on the Obama side.
But if you listen to Trump, he acts like he inherited this bare cupboard, like no ammunitions, no ventilators, no nothing. Not to get listen, I don't want to Trump bash, and I don't want to Obama, so I mean, I'm not going to make it, it's no secret. Look at my Facebook page. I don't like Trump, and I've never liked Trump. But mostly because I think he's a bombastic fool more than anything else. I don't think he's credible. I mean, he's a reality star. So that's the only reason. I mean, I think he's got some good people around him. I think he's got a good policy on China. So I think there's just a lot of things. Trump, there's good things about Trump. There's bad things about Trump. The fact that he wasn't ready for this when the CDC, the WHO, everyone said something was coming, and he kind of dismantled the whole thing. And it maybe wasn't him. Remember, he's just the guy at the top. Right. So it may have been, when you look at how the administration came together and how all the, what they're really trying to do is help corporations. I mean, look at with the PPP loans, right? Who got Ruth's Chris got $20 million, right? But they employ a lot of people. Don't be
well, but it's supposed to be for companies less than 500 people.
I know, I get it.
So
when we were training, I mean, we respected organizations like the CDC and the World Health Organization. Mm-hmm. Now Trump has defunded the World Health Organization because we give them $600 million a year versus China, who gives them $50 million a year. And he says they're a parrot of China. They do whatever China wants to say, and that's unfair. So do you believe any of the data now from World Health Organization, CDC? Do you think they've lost their credibility, or where do you stand on that?
Listen, I think that with Trump, what has come is that we don't know what's true. It's been a whole series of misinformation, and we don't know what's true where. And so I just stay out of it, and it's really hard. I mean,
forward, are you going to trust the data coming out from the
I mean, I trust the CDC. I don't know about the WHO. I don't really pay attention. I mean, I've never had to pay attention to it before. I'm a surgeon. I'm a community surgeon. I take care of gallbladders and hernias and appendixes. I mean, that's like been my bread and butter. And so to come in and have to take care of this is very, very different. And, frankly, these are not things that, before this happened, I mean, were you really looking at the WHO when you were doing bariatrics?
Well, only their obesity related kind of reports. Whenever I had to talk about how it's a global issue. But no, I usually stayed with my own professional organization.
Yeah. So I mean, it's who do we trust? I don't know. I mean, I just think that that's been the whole mission of this administration, is to, kind of spread misinformation, and we don't know who to trust, and that's really frustrating.
So what are your biggest lessons learned if we face another pandemic like this in the future? What are you going to do differently, or what are you doing?
What would I do differently? I don't know that I would do anything differently. I mean, I hunkered down right away. I ran up to Cape Cod to get my son, and he's been here. He's going to have his birthday here, instead of, being able to be with his friends and stuff. So, I think the one thing that I would say as a medical professional is I probably stay out of medicine so I don't have to go into it. This is scary. I mean, the doctors and nurses and phlebotomists and respiratory therapists and, people are dying.
Yeah.
Because of this. And people, and what is really interesting is is that I'm getting comments that are like, thank you for your service, but I'm not in the military. I am not obligated to do this. This is just a career choice. And so when people say thank you for your service, it's like, well, it's a little bit off-putting because I'm not in the military, and so that's no, I do. I do appreciate it because it's a lot better than getting spat upon for, maybe carrying the virus around, which is also happening. That's something else that's happening. So,
yeah, I think that's weird too. When there are people who, and not doctors, I never wore scrubs out in public. And most of the time now, people who wear scrubs out in public are our reps, our drug reps, product reps, assistants. And they're not even really doctors that are wearing scrubs out in public anymore. Do you wear scrubs out in public?
I do. I mean, but I have like my own branded scrubs. So, I'll wear them. I'll wear them out. Although I don't like to wear it like I'll wear them from my home and then change in the hospital. But I don't like to like go out, like I feel gross if I'm wearing like scrubs in a restaurant or something.
Yeah. But I think, fear makes people act strange,
Yes.
I think, and I think they're attacking people in scrubs just because at the time they were really, really afraid.
I think that, people are dying and people are afraid. And I think that makes sense, but I don't think it makes sense to attack people in scrubs who are trying to help, save your life.
Yeah. That's a lot like, back in the 70s, I'm from Vietnam and product of the Vietnam War, but when the Vietnam veterans came home, they got spat on and called names and stuff like that.
Yeah. I remember that.
It really affected a whole generation of the military. It was a very good life at the time. So I'd like to see us kind of unify more as a country and put politics aside, put religion aside, put criticism aside, and just say, hey, listen, we've got problems in our infrastructure. We have problems in our medicine delivery. And I don't want to get into like 80% of our medicines come from China. All of our products come from China. But I think this is a great time. We have the choice right now to either rally together as a country or let this shit tear us apart.
Yeah. And it's going to depend on, listen, it's coming from the top, right? We're going to follow the leader. And so if the leader says we need to rally together as a country, then we're going to probably do that. And if the leader doesn't, and the whole thing is like, where's Biden in all of this? He's like disappeared off the face of the earth.
That's what I said. There's no way he's going to win.
No, and it doesn't matter. I mean, I don't care. I really don't. I mean, I'm just going to do my thing, and that's it. And my goal is to help as many women, make menopause their best time in their lives as I can.
Well, on that note, man, Michelle Gordon, I'd like to take this opportunity to just honor you and all your service, all your hard work.
Thank you.
Stuff out there on the front lines, taking care of the sickest COVID patients who are in the ICU, who need lines and operations and everything, and putting yourself in harm's way and sharing it with us, your insights. So I'd love to have this opportunity for you to just say what you're working on, your projects, how people can help support you, and especially your 2-week free course where you're going to help people with menopause. Can you kind of?
Yeah, so I'm gonna be giving it's a beta course, so you get kind of gonna build it with me, and it's just like a first week is about hormones, second week is about managing your menopause, and we're gonna do a couple of group coaching calls each week, so you get a lot of interaction with me, and all you have to do is to apply is go to bit.ly/Menobeta. MENOBETA. And all you have to do, I mean, it's a $2,000 course, but we're giving it to you for free in exchange for your feedback and testimonial. It's true.
Of course, I'm doing $19 a month.
Yeah, $2,000 course. Yeah, it's going to be intense, and so we're going to be opening the Facebook group on next Friday, and we're starting the course on the 27th. So if you want to get in, we're going to limit it to just a few hundred people. So make sure you get your application in.
Yes, and for your level of expertise, that's amazing.
Yeah, I'm really excited about delivering this course. It's going to be really, really fun.
And it starts when? Next Friday?
But we're going to open up the Facebook. So you're going to be waiting in the Facebook group. Probably if you're approved, you'll be waiting in the Facebook group until Friday next week. And then we're going to start the course on the 27th.
On the 27th, but apply now.
Yeah. But apply now to secure your spot and make sure that, we have to review your application, but yeah.
And only about 150 slots, right?
So a few hundred. We'll do a few hundred. We'll see how many, depends.
Up on me.
Oh. Are we still frozen?
Yeah, no, I got you now.
Okay. Yeah. I mean, we'll see. We're going to see how many people come in, but yeah, we're going to give you a great experience. That's for sure.
And someone asked, are you going to cover hot flashes and all that sort of stuff?
We're going to talk about symptoms and symptom management. We're going to talk about hormones. And yeah, that's the whole idea, is like understanding your hormones and managing your symptoms and understanding, menopause. That's the whole idea.
Someone asked earlier, what if it's a male doctor who wants to learn about hormones? Could they get in?
This course is for women. And the reason I only let women in is that women want to only talk about women about this. There's still a big stigma around menopause. And menopause, it's like a secret society that no one wants to talk about. And so we want to give people a safe place to talk about it. And so we keep it private.
Maybe in the future, you and I can work together on male menopause.
Menopause.
Yeah,
that'd be great. Menopause, andropause. Yeah, the loss of testosterone with age. Although I'm not as much of an expert in that as I am in menopause, having gone through it myself. Are you froze? Yeah,
oh, I'm good now.
All right, better.
One more time, and then I'll let you go, Doc.
All right. Well, you got another question or no?
No, just I want you to throw your.
Oh, yeah. So, can you put it in a comment and put it up on the screen? It's bit.ly/Menobeta, MENOBETA.
Awesome. Thank you. All right, Doc. Thank you. It was great having you.
Thanks so much. Thanks everybody for coming on and sharing and joining in on the beta.
All right. She's out of here. Thank you guys so much for watching. What did you think of that interview? Did you have fun? Did you enjoy it? We had almost 1,800 people watching, both on Facebook as well as YouTube. As always, I will edit this down so that you'll be able to share this in the future. Make sure that you guys check out her website, a two-week free course. Get in on that beta test. It's an amazing opportunity for you guys. She's offering it to viewers of my page and my fan following. So don't miss out on that opportunity. And as always, our thoughts and wishes go out to the people on the front line, our healthcare workers, doctors, nurses, phlebotomists, our tech people, even our front desk people and administrators. So take care of each other, be safe, be kind. And tomorrow at noon, Saturday, April 18th at noon, I will have celebrity chef Todd English on to talk about how coronavirus has affected the restaurant industry as well as restaurant workers and what they're doing to prepare for when we open back up the country. So that's tomorrow at noon, celebrity chef Todd English.